Hi, I'm Dr. Elliott here. I'm the medical director of the kidney transplant program at Massachusetts General Hospital. I want to welcome you to our kidney transplant recipient education class. There's a lot to learn when you're considering kidney transplantation. We hope in the next 40 to 45 minutes to give you a very broad but also deep understanding of the risks and the benefits of kidney transplantation. Let me welcome you again to Massachusetts General Hospital and tell you a little bit about our kidney transplant program, which began in 1963, making us one of the oldest programs in the country. In addition to performing kidney transplants, at Mass General we perform liver, pancreas, heart, and lung transplants, and we're consistently the largest transplant program in New England. We're known for our innovation. We do a lot of research here, particularly in the area of transplant tolerance, which is the research effort to allow transplant to occur without immunosuppression or anti-rejection medications. Mass General has twice been named the #1 hospital in U.S. News and World Report's annual survey of America's best hospitals based on quality of care, patient safety, and reputation. Let's talk a little bit about the background and goals for this presentation. Kidney failure, which is also known as end-stage renal disease, presents many difficult challenges for patients, their families, and friends. There are effective therapies available for kidney failure, including transplantation, but the treatments aren't perfect, and it's important to understand the benefits and the risks of each. The goal of this presentation is to help you understand kidney transplantation so you can make an informed decision about whether it makes sense for you. If you decide to proceed with kidney transplant evaluation, we will ask you to sign an informed consent for evaluation. If you're not on dialysis, I wanted to make a couple of points that preserving your own kidney function is the most important goal, and you can think of that as Plan A. Kidney transplantation may be a good backup plan or Plan B if and when you reach kidney failure. Some kidney diseases progress quickly, others may progress slowly or not at all, and some patients remain stable with reduced kidney function for many months or years. Your primary nephrologist or kidney doctor is the best person to judge how your kidneys are doing and whether you are close to needing a transplant or dialysis. To understand kidney transplantation, it's important to understand what the kidneys are, where they're located, and what they do. The kidneys are internal organs located behind the abdominal cavity in front of the back muscles, one on either side of the spine. Most people have 2 kidneys. The kidneys perform many important functions, including the removal of toxic waste products from the blood, the regulation of the amount of water and salt in the blood, and the production of hormones such as erythropoietin, which regulates red blood cell production by the bone marrow, and activated vitamin D, which is important for bone health. There are many signs and symptoms of kidney disease, as you can see in this cartoon. Many patients report fatigue and weakness, and have loss of appetite, nausea, or vomiting on occasion. There's often increased urinary frequency and nighttime urination. There can be swelling of the ankles, a pins and needles feeling in the ankles or feet, which is referred to as neuropathy. And many patients experience muscle cramps, particularly at night. Itching is a common symptom. High blood pressure may be observed, and in severe cases, heart failure may occur. Patients report abnormal taste, which contributes to their loss of appetite, and can experience difficulty concentrating, confusion, and poor sleep. Let's talk about end-stage renal disease. End-stage renal or end-stage kidney disease occurs when a patient's kidney function is no longer adequate to maintain life. This is also known as renal or kidney failure. Earlier stages are often called CKD or chronic kidney disease. End-stage renal disease is the final or worst stage of CKD, sometimes referred to as CKD5. There are nearly 700,000 patients who are alive with kidney failure in the United States. 475,000 of these are on dialysis, and about 200,000 have functioning kidney transplants. There were more than 120,000 new cases of kidney failure in 2014 in the United States. Diabetes is by far the most common cause of kidney failure, accounting for 40 to 50% of all cases. Hypertension is the second most common cause. Then there are other causes such as reflux disease, called urologic diseases, cystic kidney disease or polycystic kidney disease, and then a series of very rare conditions called glomerulonephritis account for about 15% of the causes.